that situation ends up the president. And we know what happens when we get a bad president.
Yeah, that's right.
Yeah.
That's right, Ben. What are you drinking?
Merlot red wine.
Lucky you.
And I haven't had my dinner yet. I'll have it straight after this.
Ah.
Have you had yours?
Sort of.
Sort of.
Not really. Yeah. Not really, but yeah.
You're not dancing to start off with tonight?
Pardon?
You're not dancing to start off with tonight?
No, Ben. No.
Oh, did the money
My community, Ben, I have to tell you this whilst I'm on live. They are bullies. And no matter how much good you try to do, people always try to come from behind, to try and just sort of like tarnish your image or to sabotage whatever the little you're doing. You're not taking anything from anybody, but that's the kind of community I belong in, if I have to say. So, yeah. Hi, Ben. So, yeah, I'm not dancing today. I'm a little bit upset. I've been busy the whole day work. And then you come to this and it's like, no, I don't know if we're going to talk about COVID-19 today. I'm quite upset, really.
I know, that's something that's not quite right with you. We'll get you right again.
I don't know about that, Ben. My community, and I'm saying this, I don't know who is here. Hang on, let me see. This is a community of bullies. We try to help them. You try to give to them. You give for free. And all they do is to go all behind. The only way to achieve celebrity status in Zimbabwe is by becoming a bully. And everybody follows you. That's what happens in Zimbabwe. It's pathetic, really. That's how. And if you try to do any good, and then you tend to wonder why we've got a government like that, because obviously, that's what we do to one another. And one person does something that you're not taking anything from anybody. All you're doing is giving and giving and giving. And what people do is they sabotage and, they'll do anything. I've spent the last 2 weeks, and I think I did tell you like a few days ago that people have been trying to attack the Facebook and all sorts of things. Like you'd wonder how much time a person kind of like spends, trying to come up with a strategy and a trick to bring someone down or something down. And then now they're after the YouTube as well. And it's just like, seriously, I know most people do those things to try and make money out of that, but that's not what I'm after. I don't need some stupid, dirty money to, anyway. Hi, Ben, once again.
Hi, Katrina. I will talk to that when there's enough people online to respond to it. I don't know, or should I?
Yeah, respond, Ben. People can watch this later. I just don't care. It's either people come and take something from this, And it's funny because it's the very same people who actually are trying to learn something from me, that come and behind the scenes, they bite you and with one side of their lips and they kiss you with another. You know what? Just stay in your own pages or stay in your own YouTube channels or whatever. You don't need to come and follow or listen to what I do. And then, I'm not in competition. Nobody can compete with me. I don't compete with anybody. You know that. I don't even want to compete with anyone. The only person I compete with, I can't even compete with you. The only person I compete with is me, because I want to be better than the person I was yesterday. So if anyone comes and tries to think that like maybe the reason we do what we do is to try and get something out of them, or we're competing or comparing ourselves with them, I don't do that. But that's the kind of community I come from. That's Zimbabwe for you. If you thought you got into business with somebody that has like a good baking, no, sorry. They might end up attacking you too, and maybe, yeah.
Never.
That's so maybe it's time for me to just say that this page belongs to New Zealand, and then anything that anybody does here, I'll just get the New Zealand whatever team to get on top of it, because they do that, and then you sue them. It's like, where do they start from? Don't want to spend most of your time doing some legal battles with people that you actually are trying to help.
This is a defining moment for me and any of the audience that happen to be listening, in that I've known Katina for 5 years now, and as it happens, we're at opposite ends of New Zealand, and I'm in business with Katina as well. And I have never known a more delightful, giving, heartfelt person in my life before. And she would give her soul away to help others. And it's really, really important that to know she's an incredibly gifted person, but it wasn't given to her. She strived to better herself, as she's just said, more and more all the time. She strived to get an education, and she left Zimbabwe and moved to a new culture. And that's very difficult to do. A whole new culture in a large city with a different base language. And she worked for many years, 5 years or so, in an intensive care unit in New Zealand's largest city. And so in many ways, she's given back to the country that's adopted her and saved many lives, and along the line, to increase her education, as if it wasn't enough already, she did a master's degree in nursing in New Zealand. And on top of that, she additionally got honours with her master's degree. And then she went on to do something in New Zealand called nurse practitioner. She's just got one more paper to go to get nurse practitioner status. And on top of that, she does marathons and ultra marathons as well. And on top of that, she also raises two most beautiful, well brought up, delightful children as well. And I think it's really important to know within that, she still finds time to share and give back to people wherever she can. And the toughest people are also the most sensitive as well underneath it. And it's come to my attention recently that there's many posts and blogs on YouTube and Facebook that are starting to attack her. And although that can happen in any country and does happen in any country around the world, and incidentally, that's why I do not have YouTube, but can happen in any country around the world, including, I understand, perhaps even especially in Zimbabwe. And we give, via these talk shows and chats and information exchanges, a lot of our time to actually, perhaps arrogantly, but I hope not, think we may be able to give something of value back to Zimbabwe and any other people listening, and sharing and caring. Realistically, in any workplace or any society, there's always a little bit of one-upmanship and a little bit of trying to take tall poppies down and reduce people who have worked for it and done well. But I think we should be very, very mindful that when we're doing that, we're also cheapening ourselves. We're doing sly shots from the side, trying to bring down people that you would like to be yourself. And it shows an underlying security in many ways. And I just wish people would spare a thought, and rather than sending negatives on these faceless opportunities on YouTube and such like, rather than sending negatives to try and take down people that you would like to be, that you actually send positives, and many do, but send positives. Just take a moment of thought and reflection to thank people who have strived to become what they are, and strived even more to set aside the time to give back and help people from where they came from. One of the sad things that can happen in communities is when we do take down tall poppies, they become even stronger and try taking them down, and that can often change them as well underneath. So we get presidents, including in Zimbabwe, who are the worst of the lot. They're the toughest and the most senseless people, selfish and brutal, because we ourselves, in some ways, have helped make them that way. And I'm sure
Yeah,
you've had
we have actually, and we're doing that.
Pardon?
We have been doing that because these
That's
people can
right.
only become what we are behind the scenes. And there's no point in us complaining about how bad the politics is, how bad the government is, when we ourselves are representing that government ourselves behind the scenes. That's what we are, and that's what they are.
That's right. And that's what I'm trying to say, maybe not very well, that in some ways we have created the very system that we despise most. We create the presidents and the governments that we despise. We've created them by continually buffeting them all the time until they can put up with anything and put a wall around themselves so they care about nobody. So I just ask, if you do not want to lose it, do not bite the hand that's offering support and offer encouragement and positives instead, not just on a venue or portal like this, but also in your everyday life with family and friends and others in your community. I think it's really important that we are strong, but we show our strength by support and giving and kind relationships and support. Katina, you may have something else to add on that, but I've said my piece and it's really important. Do not abuse it or you'll lose it.
Well, I mean, it is now part of our culture. It's known. You go to the UK, you come here in New Zealand, do you ever hear me talking about, like, other than maybe on very rare occasions, you hear me saying I'm doing something with the Zimbabwean here and there. It's probably once or twice in a year that you hear me saying that. It's the most disunited nation in this whole entire world. You know, like I told you before, for people to be called celebrities in New Zealand, what do? It's either they're like really doing exceptionally good, right? You go to America, they're doing something great. Of course, they end up doing drugs and stuff like that. But nah, in Zimbabwe, if you want to be called a celebrity, you have to insult somebody and degrade them and totally treat them like trash, and that's it. So they think that by dimming the light of somebody who absolutely has nothing to do with them, they think that's how they attain fame. And you find even like ordinary people who have absolutely nothing, then like they're carrying a phone, broken phone, tied with like ropes. That's the person that's actually supporting all that kind of behavior, where they would insult you. They'll insult a person like me because you look too darker than them. They insult you for that. They would insult you because you don't have the same hairstyle as them and stuff like that. So yeah, that's the kind of nation we come from. But anyway, having said that, I think I'm real upset. And if anybody has got any questions to do with COVID-19, they can ask. That is, if they can, if they want to. But
I'm going to add that anyone can change from the person they were yesterday. And I just ask people, I know you're easing away from what we've been talking about, just ask people to say 3 positives every day to people around you, and for the next week or two, take time out to say the positives. Say the positives to Katina online, say the positives to your family, say the positive to somebody who may or may not be a celebrity, but is genuine and needs support in your community. And together, and that's what these joint communications are about, together, that can grow into a strong political or even social movement for change. And it is needed if we want to be caring and sharing. Anyway, COVID.
Yeah, like if we look, I mean, yeah, no, we can just have a chat here. Like if you look at, like, I always wonder about people like, you know, Martin Luther King, the Mother Teresa's, and all those people. Like, how did they even start? They didn't do it to get anything. You know what I mean?
That's right.
And, I mean, I've been quite thick-skinned with some of the things that I've experienced with Zimbabweans. Like, I think you've heard me, like, over the last maybe 3 months telling you about all the stuff that I've experienced here, but I'm still here. But there's some people who can't stand it, really. They end up becoming hopeless and really not, you know, living to reach their potentials because of something that somebody said or did to them. because these people, I'm telling you, they are like, honestly, Julie, my Jaden, hi, what's up? So they're like, it's like they'll attack you like, what's this animal that really attacks you? In all it does is just ready to attack. That's what they do. What for is the question, you know? But anyway, having said that,
Hi, Julie. Just
I've made my peace, but I think moving forward, I think people shouldn't be surprised on why, like, sometimes I might end up having to involve the New Zealand authorities to manage this page, because sometimes people have to understand what humanity, like standing for human rights, what standing for humanity is. I may have started like appearing like as if I'm just a nobody, but I think it's time to actually start showing people that, listen, you can't continue treating people, well, maybe they have done it before and they've managed to, but I think knowing that we've got these ways around some of these things, if you know what I mean. And maybe
we'll get back to Julie May Jaden. As I apologize for pronunciation, but I'll just end up that I think Katina's on a slightly low ebb at the moment, and I don't see that often. And we're going to fire her up again. She gives selflessly of her time every week, ongoing, huge hours, does not get any payment for it at all, and she does fantastically well. So
maybe I should start paying myself for this. No, I do pay myself for those. So you know, I pay myself for this time.
Anyway, Julie May Jaden, as I said, apologies for my pronunciation, but you may have a question, and hi to you too. You may have a question, I don't know, or anyone else with questions.
I do have a question. What's happening in New Zealand right now? I think somebody asked me this morning. They said, what's up with New Zealand now? You guys, like, you were the first country to sort of like come out of this COVID-19 isolation period. And then, like, how many days later, 100 days later, you guys, you kind of like went back into it again. What's up? What happened? How many cases do we have right now? I know we're down to level 2 or whatever. I didn't even see the difference, Ben. I just know my kids were at home, but I couldn't wait for them to go to school, believe me.
And high evidence too, as well. I came on before briefly. The lockdowns, yes. I think that on the one hand, New Zealand appears to have done really, really well by going in early and going in fast to lock down, secure our borders, but we are lucky from that point of view of having sea all the way around. So we're able to what's called eliminate the COVID virus. Other than that, the borders and the odd leak. So yes, we've just recently had an outbreak, but that's been contained again. But I'm also at odds to most people. And in some ways, the government here has got a monopoly. Everyone's gone in behind them, and New Zealand's very good at putting everything into something. And they've eliminated the virus based on mathematical models that we may have 11 to 20,000 deaths out of a population of 5 million if we did not lock down fast and early. But since that time, more evidence is gathered around the world, and those initial models were actually probably not very accurate. And we may have perhaps only, and I use the word advisedly, only lost 2,000 people if we'd let it go through. But by not letting it go through, we may have lost 70,000 jobs with the businesses that couldn't keep going. And to a certain extent, health is gauged by economic wealth. The average wealth of a country, when it goes up, should also correlate with increased health outcomes. So when businesses go bust and more people are unemployed, there's less wealth in the country, so there's less health in the country. And the evidence from overseas shows that COVID actually, for the average population, only has the death rate of perhaps a bad flu year, perhaps a little bit more than the bad flu year, which is not good, but nor is it lots, nor does it justify putting tens of thousands of people out of work and all the social stress that occurs with that, and many, even suicides, relationship breakdowns, and everything else. And so perhaps now is the time that we know the mortality rate's not nearly as high as was originally thought, to let the fear go behind and get on with life and let us build up an immunity in the population New Zealand wide. But there was a question I think came up, Katina. Is there one that came up?
Yes, there is. Sorry, I'm just
and then I can say
it on tonight. Yeah, there is. You can read that one, can you?
Okay, my question to Ben is, here in the UK, the schools are open today. Should we be worried sending our children back to school? Are our children safe from COVID-19? I'm worried myself. Good question. I was just listening to, thanks Julie, my Jaden. I was just listening to a long 4 hours worth today of, there's a good www.covidplanb.co.nz, covidplanb.co.nz, and there are a number of international people talking on that. So www.covidplanb.co.nz, and they note this difference between what I would say is absolute numbers and percentage numbers. So in a very large population, 20 can seem like a lot. Or in the United States, 100,000 can seem like a lot. But every 100,000 deaths in the United States is 0.03% of their population. So the absolute number is 100,000. The percentage number is 0.03% of the population. So yes, if I make the bland statement, children can catch COVID, but actually they have much less ACE2 receptor sites when they're children. And what that means is they're less likely to catch it, and they're less likely to catch it, and when they do, they catch it in lower numbers, and the mortality rate is actually very, very low. So the mortality rate of children is very low. So if you saw 9 children that had died in a headline from the United States, you'd think, wow, that's a lot. But, and this is the key point, it is less than the number of people that die in school bus accidents. Less than the number of people that die in school bus accidents. So we have to be careful that we don't get more worried about COVID than we do about school bus accidents, just to put it in perspective, deaths from school bus accidents. So no, in practice, I would be quite comfortable with my child going to school. And if I'm under 63 years old, I'm actually quite comfortable that probably 99.9% of people, at least, that catch it will survive. And so keep it in perspective. What can happen, or what could happen, and what does happen be 2 very different things. Do not spend time on your biggest fears. And obviously we want to do everything we can for our children, but they should be, on average, very safe at school, on average. Thank you. I hope that answers your question.
Yeah, but I've got a question to follow that, Ben. I know that, like, we've got our kids, they've got just gone back to school as well here in New Zealand, like since yesterday. But I think one of the things that was raised is that these kids have got grandparents at home who are over 65s. So yeah, it won't affect the kids, but they can pick it up. They'll survive even if they do. But when they go home, the chances are, can they not?
When they go home, they're going to be playing in the village, and they're just as likely to catch it from the village as well. So I think you're right. If they have any symptoms at all, thanks, Julie, my Jaden, very welcome. If they have any symptoms at all, then yes, their grandparents would be better to isolate. But their grandparents, even then, are only more likely to have serious outcomes if they have other underlying health conditions, especially high blood pressure or obesity or pulmonary heart conditions. So even then, the vast majority of people survive COVID, and even the grandparents that die of it, most of them would have died anyway within the next 12 months of the other underlying health conditions that they had.
No. This brings me to, like, you see, evidence Chatiza says my cousin passed on last week from coronavirus. I'm sorry about that. It brings me to that statement you just said now, Ben. Sorry to hear that evidence. My condolences, my condolences to you. But you see, I was passing a comment this morning to people, and I said we've got so many people are dying from, like, say, I told you how we had one of our activists, they're dying from our Ben. I'm just all over the place right now. From, I told you he died from a cancer, right? People are dying from other things. Okay, not corona. So, like, okay, her cousin died a week ago. Would it be wrong for me to say that, or to ask her to say, did your cousin have any other underlying known conditions before? Or was it really COVID-19? Because from my experience so far, whenever I've checked to say, like, somebody has died from COVID-19, they do have something else, other than COVID-19. So is that something that I could space now?
My condolences to evidence. It's tragic when someone we know dies of it. And I agree with Katina. It's very likely they had another underlying health condition if they were under 63. And it is tragic when it's something like coronavirus, which is new to our understanding and new to us getting used to, for want of a better word of saying it. If they had died of influenza, would it have had a different impact on how you felt? Is it the COVID that makes it worse still? Or if it had been more random and they'd had no underlying health condition, but they'd died in a car accident? Somehow we factor into our lives. It's never nice when it happens, when someone we are close to dies or that we know die. It's never, ever nice. But when it is something we're semi-used to and programmed in, yes, there's hundreds or thousands of car accidents a year, or yes, there are hundreds or thousands of deaths from pneumonia a year, or yes, there's hundreds or thousands of deaths from smoking every year. Is it different when we have fewer cases of COVID deaths? Do we respond differently because that's a new one we haven't factored in to our fare system? That would be the only comment I'd make. Because at the moment, at least in New Zealand, we have about 5,000 deaths from smoking every year. And we're a comparatively low smoking country now. So smoking-related deaths, 5,000 a year. If we let COVID go through the country, we may have had 2,000 deaths in 1 year only, but much less the following year. We have 5,000 deaths every year ongoing from smoking. I just think keep that proportionality somewhere, although that won't be possible with a new death because it's devastating anyway. Thank you.
No, like, Ben, the other thing, one other comment. Okay, I've got two actually. The first one I want to ask you is, so you mentioned that usually there's an underlying condition, maybe some pulmonary condition underlying, or high blood pressure and stuff like that. Oh, yeah. But which is the highest linked underlying condition that we have that like when someone gets COVID-19, they are most likely, their chances of surviving are very low.
Okay, the main one I think would be, I'm going to give 4. Blood pressure, high blood pressure, which can tie up with obesity and diabetes. You're welcome, Evidence. Can tie up with obesity and diabetes. So high blood pressure, then I'd say cardiopulmonary. So heart come respiratory conditions. They're the 2 highest. They're the highest categories by far. And ultimately, age. So 70, 80, and 90-year-old, we have a lot of underlying inflammatory conditions. So age is an increasing risk factor as well. So a 70 or 80-year-old with obesity, high blood pressure, they're a lot more increased risk still. But still, 99% of them will survive.
Well, that's inevitable, Ben, unless they were like crazy, fitness fanatics like you see, then you'll know that grandma is not going to be, obese. But
can I come back to that percentage one again? And the percent, originally, the World Health Organization thought that the mortality rate, the death rate, was something like 3.4% of those that caught it. You think, well, that's what, 3.5 people out of 100 dying of COVID. That's a lot. This next part's important to understand. The original mortality rates were based on what's called the case fatality rate, CFR, case fatality rate. So if there are 100 people admitted to a hospital, 100 people admitted to a hospital with respiratory pneumonia that's found later to be COVID-19, and 4 of them die, that case fatality rate is 4%. That makes sense? 4 out of 100 died. So the case fatality rate is 4%. So you think, wow, 4 out of every 100 people with COVID die. But that is the mistake. 4 out of every 100 people who were ill enough to be admitted to hospital died. There might be 500 others that got a mild runny nose or a mild cough and never went to hospital. So if there were 500 others that happened to, it wouldn't be 3.4 per 100 admitted that died. It'd be 3.4 per 500 plus 100, which is 600, 3.4 per 600 that died. Then, so 3.4 out of 600 that had COVID virus. Then, if you actually did blood tests in that community and found it wasn't only 500 people that had had contact with COVID, there are another 2,000 that caught it, had antibodies, but showed no symptoms at all. Then the case fatality rate will be 3.4, did I say 2,000, for 2,600. That's called the denominator. So we need to know the actual total number that have caught it with or without symptoms. And that's when the initial World Health Organization said 3.4% died based on the hospitalizations. It was actually much, much lower, and it's more like 0.03, which is 3 per 10,000 that die of it. 3 per 10,000 that actually die of it, unless they are in the older age group or have these comorbidities, which then may be 3 per 1,000. Does that make sense?
Yes, but too much numbers.
I'm sorry, but it's just
numbers.
The fancy word is the denominator. We tend to judge the death rate on only those that present that are seriously ill.
All right.
Number that caught it.
Just remember you're talking to like just a general audience. You give us too much details and it's like I'm lost. Even my
My apologies.
simple for me, please.
The end result is far, far more people catch it with or without symptoms than will ever know they've caught it. So the death rate is much, much lower than is generally believed or used to be believed. It is now just, if I can use the expression, like a bad flu, yeah. No more, no worse. My question is, this is evidence, chatties, or is it? My question is that, is it safe to go to hospital if you have coronavirus or to stay at home? That's an interesting question. Thank you, evidence. If you're ill enough to have to go to hospital, then you have to go. But hospitals and rest homes, both, there's an increased chance of catching coronavirus if you didn't have it when you went there. So,
and other HAIs as well. You can go there with nothing or with just coronavirus, but you're going to get there and catch other hospital-acquired infections
that's right.
as well.
In
So
general, hospitals are good places to stay clear from. They're places where people are very ill. If you think you can make your way through it by staying at home, and if you think it's COVID, then isolate at home. But if you think you can keep away from a hospital, my advice is do so, unless you've got something like you're on dialysis or something like that. Try and stay clear of them. They are higher risk areas. So only go to them if you're seriously ill. Otherwise, you may catch one of the other infections that somebody else has. Thank you. Knock, knock, Katina.
Sorry, I was just reading something here. All right. There's something here. I was going to ask you something.
It looks like COVID is not going anywhere soon. I guess we just have to learn to live with it. If you can do that, I totally agree. Fear and or uncertainty can drive fear. Just get out and live. Welcome, evidence. Just get out and live. Live and let live. If somebody has symptoms, you may wish to see a clear, but if we're under 63, then we're very unlikely to die of it. Very unlikely to die of it. And don't let fear make it worse. Get on and live. The sooner you get immunity to it, the better. And most people that catch it will not have any symptoms at all. It's called a subclinical infection, most people that catch it. So it is actually what's been shown in countries that have done blood testing and such like, of those they thought that had it, and they thought they knew that had it because of positive tests, the actual number of people that caught it was something like 30 to 60 times higher than the general statistics show. So, yep, get on, get out, live, keep fit, keep happy, do some exercise, eat well, be positive, and send something kindly to Katina on your YouTube feedback. Thanks for sharing this information.
I'm not even streaming on YouTube right now.
Facebook, whatever. I had to slap that in. Most people are going to hospital only for oxygen anyway. That's an interesting point. If you are ill enough to need oxygen, if you're ill enough to really need oxygen, then yes, you may well have to go to hospital.
Yeah.
If you can get away without going in without the oxygen, preferably stay clear. Preferably stay clear. So if you think you can get away without it, stay clear. But
you think, Ben, you're gonna die thinking. So how do you know that you're not gonna die or you're gonna die?
Well, anyone may die any time, but the average mortality rate is not stopping. COVID's not changing the average mortality rate of over the whole population.
So can I ask Ben, so what were our numbers in New Zealand before they announced the level 2? Because I know we started with 4 and they locked us down because of 4. And then
4K in the first place.
Yeah, right, for the second lockdown.
We're up to something like 22 deaths, I think, in New Zealand, which is tiny.
I'm looking at it right now. It says we are up to 22. In total, we are up to 22 deaths since coronavirus started.
22 deaths. Now, I must just interrupt there and say in New Zealand, every year we have around 32,000 deaths before COVID came. We all die. And around 54,000 births in New Zealand a year. So we have about...
Did you say 54,000 deaths?
32,000 deaths a year in New Zealand. Before COVID came, we now have 32,022. You see what I mean?
Oh, yes, that's right.
On the scale of things, it is tiny. And as I said, in the United States, every 100,000 deaths out of 330 million is 0.03% of their population. In other words, the average age will stay the same. Get on with life and live it. So I hope that answers you, Nayara Edzo Mangyonga.
Not a question, that was a comment. So he was just commenting on the first, oh no, the one about going to the hospital. And I actually do agree that like most people go to the hospital only when they need oxygen or they need ventilation support. So
I'm just going to say one other thing with the oxygen. A number of people for different health conditions, there's a thing called chronic obstructive pulmonary disease, have a bit of oxygen. There is quite a lot of evidence to show if that oxygen is what's called nebulized, and so a little bit of water vapor is added to it to make it easier for the person to have. When that person breathes out, that water vapor comes out again with the oxygen in it. And if they did have COVID, the people around them, now that might be someone else in a hospital bed, or it might be a staff member, can catch it very easily. So if you're in the next, you're welcome, Faru. If the person, if you happen to be in the bed next to somebody who's on oxygen, if it was nebulized or water moistened oxygen, that could increase your risk. So once again, unless you need to, don't go to hospital. best to isolate yourself at home. You won't know if it's COVID or not generally, but best to isolate yourself at home. One of the key things of recognizing it may be COVID, if you're getting more seriously ill, is significant difficulty in breathing. Significant difficulty in breathing. Thank you. Julie, I have seen a trend of people wearing their mask on the neck. That doesn't look safe to me. If you mean the bands around the back on the neck, I think you probably mean. With the air tags to hold a mask on, as it happens, they do not work nearly as well as when the ties are behind the head rather than over the ear. All the time with masks and all these other procedures, we are reducing risk. So you reduce with the same mask, you reduce the risk even more if you do the tie behind the head rather than around the ear. If the mask is around the neck that way, then it's hopeless. But if a tie, one tie might be low down, but another tie will need to be higher up. And try and reduce any air gaps around the mask for it to be more effective. Using the analogy, if I have COVID and I'm smoking, then the way to try and keep smoke out from going around your mask is not to have any gaps around the edge of the mask. And for me with a beard, that's not very practical. But I'm not going to shave my beard off because I'm not worried enough about COVID as it happens I would sooner, personally, I'd actually sooner catch it now than when I'm older. And whatever I am, 65 now, and I'd sooner catch COVID now than catch it in 5 years' time. There's a very low chance I may die from it now, but there's a slightly increased chance that I'd die from it in 5 years' time. I have no underlying health conditions at all. I'm fit and healthy. Thank you, Julie. Maj Aiden.
Sorry, I was just on voicemail. No, sorry, I'm here because your friend Mark is not here. I told you, hey. Okay.
Yep. You're going very well, but people need to send more positives into Katina.
Oh.
I'm worried. Well, she needs to get some
TLC.
Some
Auckland this week.
Evidence again. Is it safe to wear a mask the whole day? Once again, a good question. Thanks, Evidence. Yes, it is. Well, it's not dangerous to wear a mask the whole day, I'll put it that way, unless perhaps you had a significant asthma or something like that and you couldn't breathe. In general, when a mask gets wet or damp, it is less effective, but it will still work better than no mask. If you're outside and there's not many people about, there's probably no need to wear a mask. It's just, I always come back to, if one of the people outside was smoking, how much smoke would you breathe in? So if it's crowded enough that a number of people were smoking, where you smell smoke is the equivalent of where you would catch the COVID virus. So if there's enough space outside that you're unlikely to smell smoke, if everyone around you is smoking, or very little smoke, you probably don't need a mask there. But as soon as you go inside, of course, smoke doesn't dissipate very well, nor does COVID virus that's breathed out by others. So wet mask, not as good, but still better than no mask. And the mask, the virus, COVID virus, will generally die, say on a mask, within 24 hours, but at least by 3 days. It may technically still be alive, but in very, very low numbers. So generally after 1 day, if you had 2 masks and kept wearing your same mask every second day and the other one every second day, that should be safe. Just be careful when you take it off, because if it's worked, there may be a lot of virus on the mask at that stage. But this particular virus, the COVID virus, as with influenza, dies fairly fast in the environment, especially on soft material rather than hard surfaces. Thank you.
Thank you, Ben.
You're welcome. Thank you, Evidence.
Why do they ban serology testing in New Zealand? Have they started doing that yet?
It's a great tragedy, I think. As I was saying before, we do not know how much COVID has been in New Zealand because we've done no serology testing at all in New Zealand. And we would only know how many people have been exposed to COVID virus if we did serology testing. So on the one hand, we have an indicator. You're welcome, Evidence. On the one hand, we would have an indicator from the swab testing. But the only way to know, and overseas it's shown to be 20 to 60 times more people have positive serology tests, which shows they've had contact with COVID virus, they've breathed it in. It's 20 to 60 times higher than those who had swab tests. And for whatever the reason, New Zealand government has done no serology testing in New Zealand. On top of the serology testing for antibodies, there's another test again, looking for things called T cells, T for tame, T for tight, T cells. They're not antibodies, they're cells that also give us immunity, and that's would be in addition to the antibodies. They can be at the same time as the antibodies, but sometimes it can be just T cells present. So we only really know how much herd immunity is in the community if we add up how many people have got antibodies and or T cells. And before we can do that, we have to do a lot of surveillance in the community. It doesn't change the outcome, but it just gives us an indication of how much longer we've got to go until there's herd immunity.
Yeah, because I mean, instead of them locking us down all the time, like each time there's a case, it's like we're gonna lock you down again. What's their reasons? Is it like one of their reasons? Or what's their reason for?
From my take on it,
they're usually so good at spending money on health issues. So what's the point?
People ask, does life have a value in financial terms? We know it does emotional terms, but does life have a value in emotional terms? And it makes us uncomfortable, but yes, life does have a value in financial terms. And we can partially work that out. Some professions have a higher death rate, accident rate. So I don't know what it is in Zimbabwe. There may be
welcome evidence.
Thank you, evidence, for giving her the positive feedback too. There we got a smile. Great.
No, I do get lots of them, believe me. No, I'll tell you something. Like, just people that come here now, if you see anyone coming and following the page, they're really good ones. It's just the other ones that, yeah.
Yep,
I'm getting over it. I'm just drinking Coca-Cola, which I shouldn't be drinking at all, but I think it's helping.
I think this is helping too. It's sort of like Coca-Cola.
Yes, then I'll see you sometime soon. I'll be flying to Christchurch soon.
Okay, look forward to it. No, I can't remember what I was saying now. Completely gone out of my head.
You were not saying anything. How many glasses have you had?
I've had one sip. It was something quite important to it. I can't remember what it was. No, it doesn't matter.
Sorry. Was it not about
again?
No, don't worry. We'll find it. We'll catch it.
Yep, no trouble. What else?
I had asked you something about the serology test and you were just trying to explain.
Yeah. So, yes, in New Zealand, why do we lock down and the money that it's costing? My personal belief is early on, we've got a prime minister who's very empathetic, and people like her kindness. And so when she was determined, we have this trouble with ethics and humans overall, that we place, I don't know if it's a trouble, it's a reality. We place more evidence on immediacy, so things that happen straight away, rather than the trade-off of things that may happen in 5 or 8 or 10 years' time. So when we heard these initial mortality rates overseas of 3.4% and such like, New Zealand, our Prime Minister immediately said, we will lock down and go hard and go fast to keep it out of the country. And it's a big call because many, many people were put out of business, tens of thousands of jobs. So that has huge follow-ons. Since that time, we know that original 3.4% mortality data was not right for the reasons I said. It's just measuring people that were particularly ill in the hospital. So now it's dropped down to something like 0.03% across the population mortality.
Is that like international? Is that internationally?
Yeah, internationally, yes.
Yeah.
0.03%.
Okay, yeah, keep going.
Across the whole population. It's higher amongst the over 60 or 70-year-olds. But that's 3 per 10,000. Now in New Zealand, that is we've had to borrow $50 billion, which will take us another 30 years to pay back again. And we may have only saved 2,000 lives, which would have died, most of them would have died anyway within 12 months of their other underlying conditions. So the reality is, on the one hand, we did very well, but any extra money that New Zealand would have normally got over the next 30 years, we're not going to be able to spend it on health and education. We're going to have to be paying it back. And so that affects many, many more people. And I believe personally that now that we know those figures have changed, we should accept it. Really protect very, very well in isolation the rest home people, the elderly, and those with known underlying health conditions, and let this relatively benign COVID go through the rest of the population that are very unlikely to die and build up the herd immunity that way. But that is unpopular politically to talk about at the moment in New Zealand.
Yeah, it is. I mean, I'm quite disappointed, really, because our current government, when it comes to how to manage things economically, they're such a socialist kind of like government.
That's right, and that's the trouble. So,
economy, yeah, they are there to impress us.
So shall we do with a hat? So shall we do with a hat? I have an expression.
What happens when they kill babies here and they euthanize people? So no, they don't.
I have an expression that politics, health, and economics are poor bedfellows. So politics is really what the general population probably wants, or what they've been told they want. But business is in some ways unpopular, but on the other hand, it is business or the economy that keeps health going and does the most benefit.
At the moment, I think we're in trouble.
We are. That's what I'm saying. We're in trouble.
In terms of like the THPs, if they are to ask for a budget at all in the next election or whatever is coming in October, responded. Good luck. I'm out of that.
We've got an election coming up, as you well know, Katina, in a few weeks' time. It was delayed by a month because of COVID, a few weeks' time. Both the main parties, the one in opposition and the one governing, are saying what the public want to hear and what the government created. And that was the government created fair, and we can only stop that fair by eliminating the virus. 80% of the population believe that, so neither the government nor the opposition will say anything different before an election, and they're both saying we want elimination. But at some stage, they're going to have to change.
Yeah, no.
That won't be till after the election.
Personally, I think, I don't know, it'll be interesting to know what's happening with the Sweden way of dealing with COVID-19. You know how they just let the virus just go and survival of the fittest. And
I really like the Swedish model. The one thing I do not like about it, which every other country in the world has done really poorly, including New Zealand, is they did not isolate the most vulnerable people, and that was the elderly with underlying health conditions.
But Ben, you said something. You say that you said they were going to die within the next 12 months.
They're going to which?
To die within the next 12 months.
Yeah,
so
most of them would have died in the next 12 months.
Them to die earlier, didn't they?
From a compassionate point of view,
I know what you mean.
It's relatively easy to isolate them really well, let it go through the rest of the population, then open it up. And it wouldn't have cost
the healthcare workers to isolate people in, because they're going to need one-on-ones or lots of isolate. Yeah, I don't know how.
When I say isolating, well, I mean isolate them, and for healthcare workers to wear N95 masks when they come in from the community to look after them.
Remember, we ran out of N95 masks, Ben, remember? And only Trump could access them, my favorite president.
We have a machine, as you know, Katina, that can re-sterilize N95 masks.
Re-sterilize for the whole world?
1.6 cents each.
Then my question was, you were mentioning the 0.3% mortality rate for COVID-19 internationally. Did you say that? What was the percentage? You said it came from 3.2, and
I've got it written down somewhere. The latest.
Okay, it's 0. something.
It's 0.03. It's around 0.1, 0.3%. Yes, which is 3 per 1,000.
0.3.
3 per. 0.3% is 3 per 1,000 people.
Not 3 per 10,000.
0.3% is 3 per 1,000, but that's across the whole population. If you were to look at the under 60-year-olds, it would drop down to something like 0.03, which is 3 per 10,000. 3 per 10,000, which is a much smaller number. 3 per 10,000.
Enough numbers, Ben. I don't like numbers except if you're talking about money. Money to get to. I wanted to ask, like, okay, compare with all the other pandemics we've had in the past. You know, when I'm listening to this, it sounds like it's something that people shouldn't be panicking about. Just follow the rules, as my brother here said, to say comply with you know, with all the rules and regulations that need to be applied. That's it. Put on a mask, clean your hands, isolate if you've got any symptoms and stuff like that, right? But comparing with all the other pandemics, Ben, I think you've given us some percentages of like what smallpox was, how many people we had. Billions. Ben,
with SARS back in whenever it was, 2001 or something, 2003, 10 out of every 100 people died. That was a 10% mortality rate, not 0.3 to 0.03, 10%.
So that's
Middle East respiratory syndrome.
Yeah,
Middle East respiratory syndrome was about 38%. 38 out of every 100.
Yeah.
H5N1 bird flu was around 58% mortality.
Okay. Tell me something like small.
I just put this in comparison. SARS, MERS, and COVID are all coronaviruses, and we've had them all within the last 20 years or under 20 years. New coronaviruses within the last 20 years. So we would be foolish not to think we're going to have at least another 1 or 2 strains of coronavirus within the next 20 years. And the average of those mortalities is between 0.3, 10, and 38%. So in some ways, this one's a miracle that the one that took off as a pandemic is such a low mortality rate, more like a bad flu year.
I know. So why did we have to lock the whole world, Ben? Has this ever happened with all the other viruses that you mentioned?
A similar thing happened.
Did we lock down?
A similar thing happened with swine flu, H1N1 swine flu. The world got petrified, and that was 2009. The world was petrified.
They didn't lock us down.
And they never locked down. But for a start, there's all these fears about should we close the borders and all the rest. And that was also not quite as bad as COVID. It was a little bit less, but the world grossly overreacted. The social and political chaos COVID has caused is well beyond what the actual infection would indicate it should do.
No, Ben,
more trouble politically and socially than we have with the actual percentage of deaths that have occurred.
Yeah. So would you agree with me that there's been some hidden political agendas on people like manage COVID-19 internationally, starting with even the scientists themselves? You know, like there's been a lot of like all these false alarms about like they found a vaccine and all the nonsense. I don't even think we need a vaccine, Ben. Do you? Asking you as a scientist yourself, like, do we really need a vaccine for this?
If there was a safe, effective, long-lasting vaccine and it worked for the over 65-year-olds or those with significant underlying health condition, yes, I think the vaccine would be good. Otherwise, like the influenza, I think, and we're unlikely to get a safe, effective, when I mean effective, 70 or 80% effective, which is much higher than influenza vaccine. It's unlikely we'll get that. So to put too much reliance on that will be a false economy, false hope.
If I can remember, you said it takes about 5 years to get a proper, like to test and get.
Now comes the next worrying thing. Trump, and this is political,
No, don't say anything bad about Trump when I'm here.
is now saying
You.
he's going to have a vaccine that's ready before the election. Now he's trying to get votes from that, so before the election. The only way you can have a vaccine ready before the election is if its safety is not checked out properly. Normally, it takes a minimum of 4 years to check out the safety properly. So if you want a vaccine to be effective, you'd also have to make it compulsory for the whole population. Now, I would not take a vaccine that was ready this September or October. I wouldn't have it because it hasn't been through enough safety processes. It takes several years to tell if there's any longer run adverse effects that come from it. And to be compulsory vaccine, that would make me very, very nervous.
Okay, leave my Trump alone. I have no idea what's happening.
I know that. I knew I was stirring up trouble by saying that.
No, it's all right. I haven't been following him for quite a bit. I don't know what he's up to. All I know is I love him. I like him because he's like me. Doesn't take nonsense, if you know what I mean.
Not at all that. He doesn't take nonsense, which is like you, but there's another side of him which is completely different.
Yeah, no, personally, I think like we've discussed that like ever since the COVID-19 started, people who had the virus, they haven't contracted it again, right? So I'm leaning more towards
reliable information.
This time.
Sorry, keep going.
Yeah, thank you.
What we're saying?
No, like we discussed that ever since it started, like in the last how many months now? 9 months now we've had it. It's like yeah, okay. We haven't had anyone who contracted the virus recontracting it again, right? Point number one.
One person has. One person.
No, I don't know. Maybe it was false.
No, one person reliably has, and we know that because now it's important I talk through this. This is out of millions of people. Some of the others who are thought to have had it,
yeah,
PCR test is incredibly sensitive. So if you've got several million virus in you, the PCR swab test cannot tell if the virus is alive or dead. It can only say it is there. So if you have COVID and the swab test is positive, and you test up to 4 months later, a little bit of those several million virus could still be there, even though they're now dead, and test positive, which is meaningless. This one case now that's been reliably reported in the world where somebody had COVID-19 and the test you can also, it's called the genome, can also be fingerprinted in effect. And this person subsequently was tested again. And the important thing was, it's about 6 months later, the important thing was they had no symptoms the second time. They had no symptoms, but they had a different fingerprint or a different genome virus the second time. So they had what's called a subclinical infection. They had the infection but without any symptoms, but we know it was a different virus compared to what they had the first time. But that's only 1 out of millions of people that have caught COVID.
Okay,
and
from
so
what
you always get rare things happen occasionally.
That's not to me. Maybe Ben, is that not a sign that maybe this virus is coming in different strains? Is that not what people should be getting out of this? What you've just told me. Because all these genomes and whatever language you're using there, is that not what this is indicating to say that the fingerprint is showing that this is like an A genome? The next time it comes, you test it. Maybe we need to start testing them according to strains like we do with the flu.
I have to be very clear. The coronavirus, the COVID virus, does not mutate. It's about 6 times less fast than the influenza virus at mutating. But it has about 30,000 little sequences. And just like fingerprints, there can be tiny changes in these sequences. That's called the genome. Tiny changes which do not change the basic characteristic of that strain. Just like our fingerprint doesn't change our basic characteristics. It's only 6 times slower than influenza that we're likely to get a whole new strain, not just a tiny little changes on the genome or the fingerprint, but a whole new strain. And that would provide troubles for vaccines because that would be a different vaccine required. But no, so far, any tiny changes, there may be some very slight changes in clinical outcome, but they're very, very slight at the moment, almost imperceptible.
Anyway, I don't mind. So my question to you was that we have agreed that other than your one case, which I'm doubting very much, where was that? Which country was that in? It was in New Zealand, was it?
I think, and I stand to be corrected, it may have been Germany, but there's always exceptions to the rule. So on general, the immunity seems to be lasting at least 9 months. That's the only information we've got to go on.
Come to
in primates, so monkeys and such sites where it's been tested, the antibodies tend to go after about 6 months, but the immunity lasts longer. That will be the T cells. The immunity can last longer, and we won't know how much longer until 1 year, 2 years, 3 years, 5 years go by. And then we will see if people start catching it again or not. And if they catch it again, as with most outbreaks and or pandemics, if we go by past pandemics, the second time they catch it, it is not nearly as serious as the first time. But we don't know how long that will be.
You haven't even given me a chance to ask the question. You know, we're here to ask questions.
You asked the question.
Trying to get you to come to the point that we don't really need to be talking about vaccines right now, especially knowing that you guys wanted to test it in Africans, on Africans. So you've mentioned that we know that people, they are growing immunity, which has now lasted at least 9 months, right?
Yes.
And then you say antibodies have been shown to say they last up to about six months so far in monkeys. Okay, that's fine.
No, and no, all right, and primates, yes, and monkeys, yes.
Okay, that's fine. So why are people pushing for this vaccine nonsense? And I mean, what's the whole point? Is it just like another one of your agenda people where you, and why pushing it in Africa as well? You know, if you know what I mean, because I don't think we are
the there've been some dreadful situations that have happened in Africa with vaccines being trialed and Africans used effectively as guinea pigs. That is totally unacceptable and it is unethical and it's awful. However,
don't do it again.
Don't blame me, it's nothing to do with me. However, even though I'm European, don't blame me. I find it repulsive. However, to test a vaccine in a pandemic, the only way to know if it works in New Zealand or in the United States or Africa or Russia is to test it in that particular population that has a different culture, different diet, different genes, to see if it works or how well it works in that particular population. So it's not part of the safety. If it was shown to be very safe in the United States, for instance, or in Russia, or China, or elsewhere, you cannot be certain it's very safe in Africa until you try it in Africa and see if the unexpected results happen in Africa that don't happen elsewhere. And there's a need for it. If it was shown the vaccine, say it was like the measles vaccine, if it was 98% effective, then it would be worth using it. So the elderly will be less likely to die from it. No, you're blocked.
You say they are likely to die within the next 12 months, Ben.
Yes.
So,
but not all of them.
Okay.
But not all of them.
All right. I'm going to end up sounding like a very uncaring nurse here. Okay. Yeah. All right. Develop the vaccine for the elderly, but in Africa, our elderly are very fit and healthy.
Yes, that's good. That's wonderful. So they're less likely to die from it. And I agree. So there's less likely to be a need for a vaccine. And as I've said before, because the Africans in general have not had access to nearly as many medicines as the more industrialized world, I think your general immunity in Africa is much better than the rest of the world. And so you're less likely to be hit as hard by COVID. At the moment, that would be my tilting of thinking. That it's just possible you may not be hit nearly as hard because you've got more robust immune systems than the rest of the industrialized world, who are comparatively wussy because they've treated far too often for far too many things with treatments they didn't need.
There we go. So is that a second man, or is that the same guy that we're talking about?
So that may, thank you, Naya. So that may or may not be the same one. I can't remember where the first one was. So it may have been Hong Kong. I thought it would probably have been Germany. Okay. But there's always, out of millions, there's always going to be some people. There's always some exceptions to the rule. It may have been Hong Kong. In fact, I'm not sure of that. But don't say scary. If it's happened once out of 1 million people or 2 million people, that is tiny. That's not scary. That's tiny. If 1 in 1 million people died in a car accident, is that scary? If 1 in 1 million people, a coconut fell on their head and they died, is that scary? If 1 in 1 million, you can carry on with this. It's unexpected, but it is an exception to the rule. And the key thing is they had no symptoms. So their first infection gave them protection from that second infection that had no symptoms. I find that not scary. I find it liberatingly good. That it gave them protection from clinical symptoms.
Well, they seem to be.
Now, some of those, you're saying there's another in America. I haven't looked specifically. There are 6 cases that have been pointed out. Even that's still tiny, 6. But some of those, for instance, in South Korea, they came back saying, yes, it may have been the original genome, the original strain that was dead. That was
just
dead.
Something like that. Yeah. Anyway, yeah, it's quite hard to know.
But it's still a tiny number.
I'm still against this vaccine thing, Ben. You know, I'm pro-vaccine vaccinations. I honestly I always recommend people to go for vaccines, but for this one, I don't really think it's necessary at the moment, especially now.
I actually agree with you, Katina, but most of New Zealand is waiting for the vaccine as the ultimate cure, and it's not going to come. Or it's very, very unlikely to come.
Oh, what are they waiting for the vaccine for? You know, they need to stop doing.
When you're fearful, and in many ways the government's created a fear in New Zealand that, oh, you're likely to die.
Oh, yeah.
You clutch at straws. You clutch at straws, and the vaccine, in some ways, is a highly unlikely salvation dream.
We're most likely to die from suicide in New Zealand than from COVID-19. Look at the suicidal rates, and then COVID-19, you know, where you just need to wash your damn hands and, you know, put on a clean mask. And I haven't put on a mask. Like, seriously, I can't stand that thing.
No, not I, but I'm going to have to pretend to put one on when I'm on a bus or public transport. I've just seen
Why
the time. My dinner's getting cold down there.
Where is it? Oh, sorry. You know, you're the one who was talking. I didn't even get to finish asking my question. Because you think I'm too damaged to even ask questions today.
Yep. So I'm going to give you a positive at the end. Thank you, Katina, for even running the show in the first place. Yeah, it's wonderful.
No, I didn't have a choice, even though I spent the whole day.
No, you're very welcome.
Ben, that's really simple. Yeah.
Yep. Thank you.
Yeah.
I am simple. And thank you for even running the show and hosting it. We all have our ups and downs, and I give you positive accolades for all you've done. I show kindness.
No, it's all good. It's all good. But yeah, no, thank you so much, guys, for joining us. And I think if you've got any questions, just jot them down here. Look, I've started to stammer all of a sudden. What's up? I think I need to have it tonight.
You ran too far in one of your runs today. You must be tired. Andrew, you've had too many of these awful barbed arrows shot at you on YouTube or Facebook or whatever, and now people are going to be kind.
Yeah. No, not that easy with Zimbabweans. It's like it's a virus. You know what? Zimbabwean is most likely to die from cyberbullying than from COVID-19.
That's right. Yes, they are. We can change tomorrow what we were yesterday. We can change tomorrow what we were yesterday, and we can all make a start at doing that today. Thank you.
No, that's fine, Ben. I think, yeah, I don't think there's any question that you didn't answer today. But next time, I think we'll come more prepared. I'm sorry, it was a little bit muddled up. But yeah, thank you guys for your questions and for your time. We're going to sign out of here. See you next Tuesday. You're going to come alone next Tuesday. You need to start hosting yourself, Ben.
Start which myself?
Hosting yourself. I just come and present you here, and then I sign out, and I leave you to read the questions and everything.
That's all right. That's good. Good to have you on board. Thank you.
Yeah, Mark is no longer here. You know that? Gone.
I do.
Fired.
He was unkind. So that's what happens to people that are unkind.